We learned over the weekend what took the life of Kyle Busch, NASCAR icon, passing away on Thursday at the age of 41. His family putting out a statement saying it was pneumonia, which brought on sepsis. This all happened really rapidly, and I am fortunate enough to have somebody I could turn to in moments like this to lend some insights on how something like this happens. Dr. Ben Wedro does a great job. Retired ER physician. Now he is writing about and teaching about medicine as well. Kind enough to give us some time on the show. And you're the first person I thought of when I saw this news come out over the weekend about how he had passed. And I actually had somebody reach out to me. Sam Yarnell, who sidekicks with me on the show, said his girlfriend, who just got through with some sort of medical school training, either physician's assistant or nurse, the first thing she thought of when she started to hear some of the details of this was sepsis. And it turns out that's what it was. So I turn to you in a moment like this and I say, how does a seemingly healthy 41-year-old go from winning a race, a week and a half ago to dead, a week or so later from something like this? How does this happen so rapidly?
Don't we wish we knew why stuff happened in medicine? It's like, why do people get sick and other people don't? So that's an existential question. We have no idea why he became ill in the first place. People get infections all the time. You go to the doctor, you go to the urgent care, the emergency department, you get antibiotics, you go home, life is good. But in a small percentage of people, and this is not to scare people, in a very tiny percentage of people, the body gets their immune system wrong, and it spirals downhill out of control. So the first question is, why did Kyle Busch get pneumonia? And the answer is, I don't know. Why do people get sick? And the second question is, does it matter how sick he got with pneumonia, or did something else kick in to cause him to be septic? So what sepsis means in my brain is there are two things. One is you get an infection somewhere in your body, whether it's on your skin, which is a cellulitis, an inflammation of the skin, or pneumonia, which is really pneumonitis, which is an inflammation of your lung. You can get infections of all sorts of things. And the body sort of walls it off, maybe needs some help with antibiotics, and then you get better. Sometimes, though, that infection can spread into the bloodstream, and that's called bacteremia. Bacteria plus emia is blood. And that's not a good thing, but, not the end of the world. But when you get septic, what has happened is your body has looked at that infection and said, oh, that's bad. We got to really, ramp up the immune system and get all those antibodies and stuff going. But it overreacts. And all of a sudden, not only does it start attacking the bacteria, it starts attacking all the other organs in the body. Ugh. And that's when you become septic, which is a bad thing.
Could pneumonia not present? Because the obvious question a lot of people are asking is, how did he not wind up at a doctor sooner? How did he not, how is this not at least starting to be treated before it got to this severe point where he's in a hospital and, within 24 hours he passes away? Could pneumonia be so subtle as to somebody just think they have a cold or a cough or something like that? Or did somebody miss something here and he should have been in a hospital sooner?
So, good question. When should you go see the doctor is what you're asking. And you should see the doctor when you're worried that something bad's happening. But you don't know if something's bad happening all the time. So the classic symptoms of pneumonia are cough, fever, shortness of breath. For an infection that's caused by a bacteria, you should probably cough up some sputum, and it should be colored sputum, sometimes rusty, classically, for a type of pneumonia called pneumococcal pneumonia. But pneumonia can be caused by a virus. And you just feel a little short of breath and cough, and you say, I'll be better in the morning. And some people aren't. People who are unhealthy, who are elderly, people who have immune system problems, people who have diabetes, some people who have kidney disease, whose bodies are not solid in the first place, are more at risk for getting sick quicker. Young, healthy people tend to fight pneumonia pretty well, and then they show up to the doctor because they get a fever and they cough and they're feeling crappy. And so they go to be seen. And the most common thing that happens is the doctor takes a history, says, oh, yeah. They listen to you. Sometimes you can hear the pneumonia with your stethoscope. You can hear sort of a rattly sound when you listen to the lungs. So instead of like nice air flowing in and out, it doesn't sound right. You get a chest x-ray, you say, oh, there's some pneumonia. You make sure everything else is okay, that their vital signs, their pulse rate, and their blood pressure and their respiratory rate's normal. You usually don't need blood tests. Put them on some antibiotics, they go home, life is good. Almost all pneumonias in the United States are treated as outpatients. Now, there's a caveat for that. People who have COVID pneumonia all get admitted. But the good news is that the mortality rate for COVID is reaching the same as the mortality rate for bacterial infection.
Wow.
Yeah. So we've learned a lot since the first days of COVID.
So let me ask you this. As a recently retired ER physician such as yourself, by the time somebody's coming into the ER at the point he's at, what's the mortality rate? Like, how difficult is it to save somebody once they're at that point where they're coughing up blood, and that sort of thing?
Okay, two separate questions.
Sure.
Let's do the last one first. Coughing up blood does not mean you have pneumonia necessarily.
Okay.
Coughing up blood can be a whole bunch of things, and it's not normal. But it could be something as simple as you've got bronchitis and you've coughed hard and you've broken a blood vessel that's leaked into the lung and you cough up some blood. It can happen as well because of inflammation of the blood vessels because of pneumonia, but other things that can cause it, which are not more worrying, but different worrisome, are things like tuberculosis can cause you to cough up blood. Cancer can cause you to cough up blood. So blood where it doesn't belong is not normal and should always be seen. So for your listeners and your viewers out there, if you cough up blood, go get seen. Don't blow it off. That's the first thing. Second thing, people who show up in the emergency department or urgent care of their family doctor's office with pneumonia and get antibiotics, they go home, they do fine. If you get admitted to the hospital, it's because a couple things. One is you have underlying medical conditions that don't allow you to fight infection as well, or you don't have the capability to sort of recover adequately because if you get a little dehydrated from the infection, if you're breathing a little bit too fast and you get tired, those are things that you might need to have some oxygen while the antibiotics kick in. So not everyone who gets admitted to the hospital with pneumonia has sepsis. So you can have pneumonia and are sick from it and need antibiotics and supportive care like intravenous fluids and oxygen, and you get better when the pneumonia gets better.
But let me ask you, once you've diagnosed that somebody is septic, all right, let's say that's the question then. At that point, what is the ability of doctors in that moment to save somebody?
It depends, again, on their underlying condition.
Right.
Otherwise, reasonably healthy people, their mortality rate is going to be, 30 to 50%.
Wow, it's still
high. It's big. Yeah. Because being septic, having an infection that had caused your body to shut down is a big deal. So let's talk a little bit about what that means when the body shuts down.
Okay.
If you have inflammation of the blood vessels, because the body is now attacked, not only the infection, but other parts of the body. If you attack the blood vessels and they become inflamed, they start leaking fluid. So fluid leaks out of your circulation system and it drops your blood pressure. So you don't send blood and oxygen to the rest of your body. So other organs start to shut down. You drop your blood pressure, you develop weakness. If you don't supply blood to your liver, it stops to work. If you don't supply blood to your kidneys, they stop to work. And so it's not just, I've got pneumonia and my lungs are inflamed. It's like everything starts to inflame and shut down. So not only are you now trying to fight the infection, you're trying to support the heart, the lungs, the kidneys, the liver, muscles, everything, including the brain, are being affected. And so it's not just like, if we treated the infection sooner, that wouldn't have happened. Well, yeah, if you treat the infection early, the odds are you're not going to spiral out of control. But some people, and that's a big because, spiral out of control. And it's an immune response that goes haywire in the body.
And in that moment, what can you do in an emergency situation? Because that's clearly what this was. What is the course of treatment to try and save that person?
Well, the first thing is to support the heart and lungs and blood pressure. So you need intravenous fluids. Step back. You need to make the diagnosis. Because if you don't make the diagnosis, then that's bad, because then you're starting way behind. So if you walk in the room to see the patient, you say, "Oh, this is bad," then you attack the patient with nurses and doctors and respiratory therapists. You start intravenous fluids, and most importantly, you start antibiotics immediately. You may not know exactly where the infection is. You may not know exactly what type of infection. So use very broad spectrum antibiotics, things that kill everything. And then as you whittle down to where the infection is, and if you can get cultures of the blood to see what might be growing, then you can tailor the antibiotic specifically to that bug. You might need, if you can't get the blood pressure up with fluids, then you might need to use medications called pressors. And they cause the heart to beat more aggressively, causes blood vessels to narrow, so you can support the blood pressure and get blood flowing to the organs that are in need to try to recoup their function. But the big thing is, the three big things are: one, make the diagnosis or have high suspicion of it. Two, start fluids, and three, start antibiotics.
Ben, last question: what is the greatest? In all of these things, they call it the practice of medicine. They always say, because they're still practicing. That was the joke I heard once when I was in the hospital for a month. What is the greatest teaching lesson, teachable moment to come out of this, if there is one? Because we always like to try and learn something off of something tragic like this. What is the greatest lesson to be learned from this?
Kyle Busch was surrounded by family. And I do not know the circumstances
Sure.
Of how long he'd been sick, but be an advocate for your family member. If you think they're sick and they're saying, and they go, "Oh, I'm fine," and you say, "No, I really think you're sick," convince them to seek care. And I know it's difficult, especially in the U.S., where it's expensive to go to the doctor. Healthcare is difficult. You're making a financial decision as well as a healthcare decision. If you're worried about your family member, don't say, "Well, he said he's going to be fine tomorrow," or "We'll wait and see another day." Don't. If you're worried about your family member, stand up. Be their advocate. Have them be seen, so you don't have to go through the stuff that the Busch family is going through.
It just seems unconscionable for a 41-year-old to die from something like this. It blows my mind. I know it's blown the minds of a lot of people around the sports world and the NASCAR community. It just seems unthinkable for somebody that young. It really does. People
die all the time at different ages. And because Mr. Busch was a public figure, it upsets us more. Look around your community, read the obituaries, see how many people are dying at a young age, and remind yourself, we are a brother's keeper. If you see someone who needs help, make sure they get it.
Yeah. Well said. Dr. Ben Wedro, retired ER physician, now writing and teaching about medicine and teaching us. So we are grateful. Thank you, my friend. I appreciate you.
Thank you.